Hello, my name is Heather Williams. This is my micro presentation for my microbiology class. The microbe that I chose to do my presentation on is hepatitis A, B, and C. And the reason why I chose hepatitis A, B, and C is because this is a disease that I have heard on and off my whole life, but much more recently, within the last 7 years, as I have been a detention deputy. And it has when I saw hepatitis on the list as an option, I was excited because I've always wanted to explore the topic further because it's something that I come in contact with every day. The reason why is I work in a jail where it is very filthy, teeming with bacteria. We have staph infection going around all the time, excuse me, even amongst staff. Hepatitis C especially, because we have a lot of inmates that come in already with hep C due to either liver damage from being an alcoholic or from the use of IV drugs. Particularly, I work in the healthcare building where I'm always having inmates who are detoxing and basically who are sometimes coming in off the street after not seeing a doctor for years, and they find out a lot of their conditions once they arrive in jail. A few months ago, the health department showed up at my place of work, and they said that I had been exposed to hepatitis A. And so me and about 12 other deputies were given the option to receive a vaccination for it. Apparently, there was an inmate in one of the pods that I worked, and she tested positive for hepatitis A, so they wanted every single person that came in contact with that inmate, whether you touched them or not, to receive this vaccination if you hadn't been vaccinated yet. So, I mean, hey, since the health department wanted to give it, I'm sure that I had received the vaccine a long time ago when I was in the military, but just to be safe, I went ahead and opted to get vaccinated. And I have to go back in 6 months and receive a titer for it. So, hepatitis is something I come in contact with all the time, so I wanted to know a little bit more about it. Hepatitis A is vaccine preventable, communicable disease of the liver caused by the hepatitis A virus, or otherwise known as HAV for the purposes of this lecture. It is usually transmitted person to person through the fecal oral route or consumption of contaminated food or water, such as if you go to a buffet and you want to grab the utensil to put some lettuce on your plate and the person in front of you just used the bathroom and probably didn't wash their hands. That's a great way of getting the hepatitis A virus. HAV is a non-enveloped, positive sense, single-stranded RNA virus. The causative agent of HAV is the heptovirus from the Picornavirdae family. It is again transmitted primarily through the fecal oral route. Disease mechanism. Since the biology of HAV is poorly understood, we study the role of the hepatitis A virus receptor 1 in pathogenesis of HAV in animal models. The molecular cloning of the RNA genome of HAV in the early 1980s revealed its organization to be similar to the genomes of poliovirus and other viruses classified within the family Picornavirdae. HAV is now classified taxonomically within a unique picornaviral genus, the genus Heptavirus, which includes only human HAV and other closely related mammalian viruses. Its single-stranded positive sense RNA genome is approximately 7.5 in length with a lengthy 5-inch untranslated RNA segment covalently linked to a small virally encoded protein. The RNA contains a single open reading frame that encodes a giant polyprotein the translation of which is initiated under control of a highly structured internal ribosome entry site, otherwise known as IRS. Regardless of the specific hepatitis virus, whether it's A, B, or C, the onset of all hepatitis symptoms are nausea, vomiting, dark urine, clay-colored stools, and often jaundice. Specifically with hepatitis A, symptoms include fatigue, nausea, abdominal pain, loss of appetite, and possibly a low-grade fever. Diagnosis involves clinical presentation, serological test known as IgM test. Those acutely infected will have antibodies of the IgM type with probably little to no IgM. Hepatitis A occurs throughout the world. It is highly endemic in some areas, particularly Central and South America, Africa, the Middle East, Asia, and the Western Pacific. Its reservoir is human, transmission is fecal-oral. The temporal pattern, there isn't one, and communicability is 2 weeks before illness to 1 week after onset of jaundice. Treatment and therapy strategies are rehydration to replace lost fluids by drinking more fluids or administering intravenous therapy, rest, which is reducing activity to promote healing, and avoid alcohol because it could aggravate certain conditions like dehydration, diarrhea. Next, we're moving on to hepatitis B. Hepatitis B virus, in this lecture will be HBV, is an enveloped DNA virus that is transmitted through the exchange of blood or bodily fluids. An example is an IV drug user that may share contaminated needles and the spread of bodily fluids through sexual intercourse. HBV does not have a fecal-oral transmission. HBV is the only hepatitis virus that has a DNA genome, which is small, but it codes for 4 viral proteins. The hepatitis B virus primarily interferes with the functions of the liver by replicating in hepatocytes. During HBV infection, the host immune response causes both hepatocellular damage and viral clearance. Although the innate immune response does not play a significant role in these processes, the adaptive immune response, in particular virus-specific cytotoxic T lymphocytes, contributes to most of the liver injury associated with HBV infection. CTLs eliminate HBV infection by killing infection cells and producing antiviral cytokines, which are then used to purge HBV from viable hepatocytes. Although liver damage is initiated and mediated by the CTLs, antigen nonspecific inflammatory cells can worsen CTL-induced immunopathology, and platelets activated at the site of infection may facilitate the accumulation of CTLs in the liver. Symptoms of acute hepatitis B, if they do appear, 2/3 of people do not present symptoms. These symptoms can include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored bowel movements, joint pain, jaundice again, which is the yellow color in the skin or the eyes. This picture that I posted here on the right is often what this jaundice color would look like. And also accumulated damage can occur, which leads to cirrhosis, which can lead to liver failure, which can lead to liver cancer. Diagnosis is occurred through clinical presentation, serum levels of HBsAg, HBeAg, and anti-HB-CLGM. During chronic infections, HBV DNA are found in the organs and tissues other than the liver and may be a reservoir for chronic infection. HBV's reservoir is human, transmission is bloodborne, subclinical cases transmit, communicability within 1 to 2 months before and after onset of symptoms. Persons with either acute or chronic HBV infection with HBsAg present in the blood. Okay, there are 4 different treatment forms for people infected with HBV. Most people diagnosed with chronic hepatitis B infection need treatment for the rest of their lives. Treatment helps reduce the risk of liver disease and prevents you from passing the infection to others. Treatment for chronic hepatitis B may include antiviral medications. Several antiviral medications, including entecavir, tenofovir, limivudine, atavir, and feblivudine, can help fight the virus and slow its ability to damage your liver. These drugs are taken by mouth. Another form of treatment is interferon injections. Interferon alpha 2b is a man-made version of a substance produced by the body to fight infection. It's used mainly for young people with hepatitis B who wish to avoid long-term treatment, or for women who might want to get pregnant within a few years after completing a finite course of therapy. Interferon should not be used during pregnancy. And of course, the side effects: nausea, vomiting, difficulty breathing, and depression. Lastly, liver transplant is a form of treatment. If your liver has been severely damaged, a liver transplant may be an option. During a liver transplant, the surgeon removes your damaged liver and replaces it with a healthy liver. Most transplant livers come from deceased donors, though a small number come from living donors who donate a portion of their livers. Lastly, we have hepatitis C. Hepatitis C is a liver infection caused by the hepatitis C virus, HCV. Hepatitis C is a blood-borne virus. Today, most people become infected with the hepatitis C virus by sharing needles or other equipment to inject drugs. For some people, hepatitis C is a short-term illness, but for 70 to 85% of people who become infected with hepatitis C, it becomes a long-term chronic infection. Chronic hepatitis C is a serious disease that can result in long-term health problems and even death. The majority of infected persons might not be aware of their infection because they are not clinically ill. There is no vaccine for hepatitis C. The best way to prevent hepatitis C is by avoiding behaviors that can spread the disease, especially injecting drugs. Causative agent. Hepatitis C virus is made up of hepatitis A and hepatitis B. These three classes are all classified into three different groups. HCV is a positive single-stranded RNA virus in the Flaviridae family. This particular genome is around 10,000 nucleotides and can encode a single polyprotein of about 3,000 amino acids. The symptom list here, it looks very much like all the other symptom lists. At the beginning of the slide, I mentioned that pretty much all the symptoms were the same for hepatitis A, B, and C. So here's the symptom list for hepatitis C, which can include fever, fatigue, dark urine, clay-colored bowel movements, abdominal pain, loss of appetite, nausea, vomiting, joint pain, and again, the jaundice color. Diagnosis for both acute and chronic disease is made by serology to detect antibody to hepatitis C and molecular assays that detect or quantify HCV viral DNA. And here is a chart for both children and adults, a symptom chart of what they may present in the office with. Globally, an estimated 130 to 150 million people are living with hepatitis C infection. Those are people who are chronically infected. And more than 700,000 were estimated to have died from HCV-related liver disease in 2013. Although the quality of epidemiologic data varies widely across countries and regions, the most recent global estimates indicate that the prevalence of HCV infection is greater than 1.5% in many developed countries, including the United States. The prevalence is higher in several countries like Latin America, Eastern Europe, and the former Soviet Union, and certain countries in Africa, the Middle East, and Asia. The prevalence is to be reported to be the highest, approximately 10%, in Egypt. Acute HCV infections are effectively treated with interferon and the antiviral drug ribavirin, which reduces synthesis of viral DNA. 3 new recently approved drugs for the treatment are sofosbuvir, a nucleotide analog inhibitor of the HCV polymerase enzyme, semprevir, a protease inhibitor, and ledipasvir, with a similar mode of action as sofosbuvir. The next 2 slides are a list of my resources where I've done some research. Thank you all for hanging in there with me through this. This was the first time I've ever recorded anything in my life. It was very nerve-wracking, and I have a whole new respect for my professors who can just get on here and talk away like it's nothing. But I'm thankful for the experience, and good luck to you all.